Boom, boom, boom.
The vino, Neil, tonight is beautiful.
The vino's
The
good.
vino, beautiful.
Let's give
Welcome, everybody, on Santa Cruz Waves, the World Wide Web,
Oh, God.
to another great show, Neil.
It's a great, great show.
You want to know why tonight's great?
Well, I want to give a shout out to Gail Newell because Gail couldn't make it tonight.
I hope Gail's watching.
So
If she is,
he said,
Gail.
Neil, contact my second in command. You know, he does all the dirty work for me. You know, I don't do shit. He does all the work. Dr. David Ghilarducci. Did I get that
You
right?
said that
You
so
got that
good.
right.
Yeah.
I mean, right now he goes,
Ghilarducci.
I thought I heard an Italian accent there.
no,
But,
because who was it? Oh, my friend Tina Davey from the station that do the show on Wednesday
Yeah,
mornings.
right. Yeah, you're a DJ.
He-
You moonlight as a
She texted me.
DJ.
He goes, Neil, I fuck up his name all day.
Ghilarducci. That's very
Ghilarducci.
Italian.
Ghilarducci, yes. Yeah, that's right.
We're going to short it up to Dr. Dave.
Yeah, or DRG.
DRG, the
Doc-
notorious
the
DRG.
notorious
The
DRG.
notorious DRG. So, let's just jump right into it. You are a county health official.
Yep.
You're a medical doctor.
Yeah.
Past firefighter. We'll get into that.
Yeah.
Currently, we are in this gigantic COVID spike.
Oh my God.
Is it straight up?
Whoa,
Can we- can we-
whoa, but wait a minute. No one knows about COVID. It's been like hush hush this time around, I think. It's been, don't you think?
The
It's a
secret
little
virus?
Huh?
The secret virus.
Can we
I
call it
don't
a
know.
secret virus?
I think the secret's out, to be honest.
Now, I just want to jump ahead just
Yeah.
1 second because I keep seeing on the news, well, everybody who goes to the hospital is tested for COVID, whether they get in a car wreck or not, and if they have
Yeah.
it goes on the stats.
Oh,
But,
right.
You know, I'm not going to sugarcoat any of that. Are we currently in a crisis?
Yeah, I'll tell you what, we are, the tsunami's coming right now, and we're right at the beginning of it. In fact, today I just had a hell of a day. I'm working with hospitals, working with our skilled nursing facilities. Everybody is having a staffing crisis. The ER is full right now. We're having trouble discharging patients out to different facilities. So I'm a little worried. We're already hit the highest number we hit last year. And so
Today.
Yeah, today.
And
And,
did you
we're
say-
still on the upswing.
Did you say the tsunami hasn't hit yet?
You know those little waves you get just before the tsunami
Yeah,
hits?
yeah.
That's where we are.
Does that scare you as a professional? Because we just follow what the media says, what I read in the Sentinel, but you are ahead of the curve. Are you a little nervous what's going on right now?
Very nervous. You know, our hospital system on a good day is right at capacity, right? And
On an average day.
On an average day, right?
Car wrecks.
Yeah, but you add in a strain like this, you add in healthcare workers that are calling in sick because they are sick. You add in just this extra strain, and we're certainly, we're beyond capacity in terms of that.
So what can you
in terms
do?
of our ability.
What can be done?
Yeah.
Or what cannot be done?
Yeah.
Is it?
Yeah, great question. I mean, we're thinking of lots of things. There's little you can do. Most of the things that need to be done have to be done ahead of time. Of course, one of the biggest things was vaccination. That's what's keeping people out of the hospital. I can't tell you, it's like, 20, 30 times less likely to end up in the hospital if you're vaccinated. Especially
Did you
if
say
you're-
20 or 30 times?
Yeah, it's incredible.
But I'm gonna ask you about something you said to me today. TC, you got vaccinated today. You got your booster shot.
Got my booster.
Right?
Yeah.
But as much as you're excited about it, it doesn't kick in for at least a couple of weeks.
Yeah.
Is that right?
It takes a
Right?
couple of weeks for your body to kind of process it and to get those antibodies up. That's right. So you still need to be careful. I mean, you remain careful the whole time, but don't expect the full protection for a couple of weeks.
Locally, what is the percentage of our local Santa Cruz County citizens that are boosted? Do you know that?
Yeah, I wish that were better. We're somewhere around probably 50-60% in those that are 65 and older, so they're doing a little better. When you get to the younger population, we're in the 20s and 30s.
And it's the younger population which are involved now with Omicron, correct?
Yeah,
they're affected by the new variant.
It's funny. I look at our charts, the age charts, and you look at the different age groups and which ones have the most cases. And right now, I think the 20 to 29-year-olds are giving us the middle finger when you look at this bar chart because that's where most of our cases are. And then you line up vaccination next to that, and that's where the least amount of vaccination is happening in that age.
TC,
Hey, first off, young young, dumb, and full of cum. But they're as strong as an ox. It'll never affect me. Famous last words.
You manage how many employees that are in that price?
How many should I have, or how many do I have?
How many
Currently, I'm like low 20s.
Okay, so how many of them are vaccinated?
All but one.
Really?
Oh,
Yeah,
okay.
actually, right now, currently, yeah, and I have, and the one probably would, but his parents won't let him because they're not into it,
Right.
Because they're gonna be. Bill Gates is gonna track him or something. I don't know.
Sure.
Does Bill Gates really care who gets the vaccine? I
Well,
mean,
you know, the Bill Gates Foundation is working on vaccines right now and trying to save world's population with malaria and so forth.
yeah,
So,
I don't get it. Why do people think Bill Gates cares about that?
Why would you want to? Why bother with malaria? We got this other problem going. We have this other problem on our doorstep. Fuck malaria.
Well,
Yeah,
no,
right,
but
right.
malaria.
Well,
probably as
use it
many
as an
people.
example.
I mean, so what's the yearly? I don't know the death toll of malaria, but I know it's always been one of the highest.
Yeah.
You know, so malaria for his.
And it hits, it disproportionately hits those countries that are poor, and so there's
Right.
So if
So for him to do that, I give him credit for that
absolutely,
because that's not about people who buy Microsoft Windows.
that's right. He's
You
not
know?
looking at customers.
Yeah, it's not about making money. It's
Yeah.
about saving the world.
Yeah.
And if more people did that, we'd be in a better place. Thank you.
Agreed.
Back to your question.
So
How do you top that?
how are we compared to last year? Because last year, I think at this point we were panicking.
Yeah.
I mean, there was a panic.
Yeah, last year at this time was a rough time too. You know, we hit our peak January 11th, 2021. That's when we started coming down. What was different last year, and this is the good news part of the bad news that I've been giving you, is this really is a different virus. There's some interesting differences, and I won't get too technical with you, but so stop me if I do. But the coronavirus tends to go after these things that are called ACE receptors, and those receptors are found throughout our body, in our lungs, in our upper airways, in our kidneys, in our liver, and so forth. It turns out that the earlier variants really targeted the lungs and the kidneys and some other areas, and so we were seeing people with severe lung damage from COVID. What we're seeing with Omicron is it now seems to be more preferential to the upper airways, so the nose, the throat, the bronchioles, the tubes that go to your lungs, but it kind of spares the lung tissue. So what I think is, and we're seeing more and more evidence come out, that people that do catch Omicron are less likely to end up in the hospital than before. That said, though, it is an extremely transmissible virus. I mean, you can catch Omicron now. We have evidence of this. That you can enter a room that somebody who had previously been in that room who was infected, you could catch it from them, even not being in the same room.
No, mask or no mask?
Mask or no mask.
It
The
almost
mask
seems
helps.
it almost seems worse because when it was a pre-Delta, like
Yeah.
a Corona, like back when we called it Corona,
Yeah,
when you got it, you were dropped. You know, you were sick.
yeah.
So now people are getting it. And they're like, maybe I got a cold,
Uh-huh.
and they're out in the public just spreading it like
yeah.
crazy.
Yeah.
Did you see this 5 years ago, 7 years ago, 10 years ago? Did you see this happening?
You know, I tell you what, we were thinking about pandemic flu, and that is still on the horizon. We did have, SARS-CoV-1. You might remember that back in 2003, mostly hit Toronto. The problem with SARS-CoV-1 was it was very deadly. So, and you also tended to show symptoms right away. And so it was a little bit easier to contain. It either killed off the host, they weren't out going to the grocery store, or they were sick and staying home.
Right.
This one is different because you tend to not feel it for a couple of days, don't even know you're sick, maybe you think you got an allergy or something, and you're spreading virus while it's happening. So, but I think what we're looking at with the Omicron, by the way, I call this the OMG virus.
The OMG?
Yeah, the OMG
Oh my
variant,
God.
yeah, exactly, right? But I think what it's showing now is we're not at the end of this pandemic, but we're at the beginning of the end. And that's the good news here.
That's what you believe.
I believe that, yeah. I believe that that in a very short order, our entire population will either be vaccinated and boosted, or will be recovered from an Omicron infection.
But the entire population won't be, because there's a lot of people who are against it.
Well, then they'll probably catch it, because I think it's almost unavoidable that you're going to catch it if you're unvaccinated.
That's unavoidable.
Are the new variants catchable? Like are we done with Omicron, or is there another Omicron?
There could be more.
Yeah, is it like?
There probably will. This virus keeps throwing curveballs at us, and there probably will be others. But You know what viruses tend to do, and we hope that that's what happens with coronavirus this time, is they tend to become more infectious, but less virulent or less pathogenic, meaning less likely to cause severe disease in most people. And so once it becomes to that stage where it's sort of easy to catch,
Right.
doesn't make too many people too sick, then we're going to have enough immunity within the population that it's not going to be a big deal. We're just going to learn to live with it.
Right.
It terrifies me to hear like there's a whole possibility of another flu.
Yeah.
You know, like a deadly flu.
Yeah.
Is that our life now? Is that like every couple of years this wave of like deadly flus are going to be in our life?
Yeah, the risk will always be there. It's not a matter of if deadly flu pandemic is going to hit again.
Well, people die of
It's
the flu.
when.
I know that, and,
Yeah.
and hundreds of thousands. But
Yeah.
but there is a possibility of having something greater than what we've been through in
Yeah.
the future.
Yeah, you know, the flu's a funny thing. You know, it can, especially if it transfers from what is typically an animal source, so it's a zoonotic infection, and crosses over to humans, like the bird flu, like the swine flu, and so forth, where we don't have any natural immunity to it. So yeah, that could potentially be really bad, like 1918, 1919.
Not sure.
Yeah.
Your wife's a teacher
Yeah,
with Santa Cruz, with Scotts Valley Middle School.
Scotts Valley Middle.
Right. She's going off to work every day,
Yeah.
and she's teaching 20 kids in a room.
Yeah.
Right. What do you tell? Do you guard her? Do you give her advice, or what is she? I mean,
Every day at work, good luck.
right?
Yeah, well, we certainly talk about it a lot. She hears me talk about it a lot.
But she's dedicated. But she's like another dedicated teacher who's just gonna show up to work.
And she's right about this. She really believes the kids need to be back in school, and so do I. We cannot sustain what we went through last year. The kind of social disruption for our kids. She sees kids in her 7th grade class that the last time they were in the classroom was in 5th grade, and she can really see the gap. The distance learning did not work for a lot of these kids. Some kids did great,
Right.
but there were a lot of kids that really fell behind. I think we'll see the after effects of that for a long time.
Well, it was tough here too because man,
Yeah.
I own a skateboard shop.
Yeah,
Those kids were pretty much left on their own
yeah.
because they have in this town. You both parents work,
Yeah,
and
absolutely.
so when little Johnny
pay the
stays,
rent.
there's no school.
Yeah,
Homeschooling didn't really happen much. The computer web thing didn't work very good, and little Johnny was running around with his bike out
Oh,
of mayhem.
So let's talk about that's in that perspective. What you're talking about. Let's talk about local. What's going on? What's going on with TC Store? What's going on with
Yeah.
our yoga studio? That him and I
The
get
current
argued,
public.
right? What can't? It seems like this since this thing is shot through the roof. No one's come down the pike and said like you or Gail or whoever. Oh, we're shutting this down. We're shutting this down. This mandate's going on. We haven't heard of anything. It just seems like
yeah. It's Gail and I, mostly Gail.
And I want to thank Gail for coming on the show a bunch of times.
Oh, she's
Yeah.
fantastic.
Gail's awesome. Thank you,
Yeah.
Gail. Yeah.
We love her to death.
Yeah.
Yeah, she's fantastic. If she's the sheriff, I'm the Barney Fife, but she's had to make some really tough decisions. As have I was the health officer for San Benito County as well. But there's a limit to what we can do, and to have the public sort of be willing to comply. And so there are costs to shutting things down as much as there are benefits to shutting things down. It's always weighing those costs and benefits between the two.
Well, back a couple of years ago, beaches were closed.
Yeah.
It was a big, huge, dramatic things that happened, right?
Yeah.
And
Yeah.
Beaches aren't going to close now.
No talk of that, no, at this point. In fact,
Right.
outdoor spaces are probably the best places to be in. And we didn't know as much about the virus back then. And of course, Santa Cruz being a kind of tourist destination, we were very worried about people coming from out of town who,
Right.
essentially importing virus. Santa Cruz County has actually done pretty damn well,
Right.
compared to other places in the country.
Which
You
is so
think-
surprising to me.
Yeah.
Why?
Because earlier I said is that this store was closed 3 months. The day I opened, I worked every day because my employees were loving those stimulus checks, and so I worked every day. And I was checking credit cards. It's like, oh, you're from Seattle, you're from Utah, you're
Yeah.
from Arizona. you're bringing coronavirus. You are infected. You are going to infect all of us. It was crazy.
Yeah.
And I was shocked that we stayed so low
Yeah.
as far as our infection rate goes.
Are things staying the same as they were because of Omicron's not as potent as other variants? You think? Like
Yeah, potent in terms of like putting you in the hospital,
Right.
that kind of thing.
it's not as
Yeah.
potent.
So I think we're seeing this kind of decoupling between case counts and hospital counts, and so we got to figure out another way to kind of measure this. And so at some point, I think case counts are going to become less and less important. Right now, you're seeing them rise like more
Right.
than the S&P 500. But at some point, we're going to see this kind of decoupling between case counts and that. The other thing is we don't really know how many cases we have anymore, especially with home testing and so
Right.
forth. So more and more we're seeing kind of a shift in how we understand what's happening with the virus here.
Well, it's interesting because when 2.5 years ago, we were talking about 70 years and above, and so there was.
Yeah.
I just felt like these cavalier young people. I'm protected. I'm young.
Yeah.
That's not the thing anymore, right? As you say, that 20 to 29.
Yeah.
Like what's happening in hospitals now, kids. I saw last night the biggest children's hospital somewhere in Texas
Mm-hmm.
full
Yeah.
right
Yeah.
now with
Right.
kids with COVID. So my question is, the cases are going up, but our hospitalizations are going up at the same pace.
Not at the same pace that they did last year.
Okay.
Yeah. But because Omicron is so transmissible, the numbers are so much higher. We've already passed nationwide high numbers. We've never seen these numbers before. Even though it's a smaller percentage that ends up in the hospital, it's still filling up the hospitals.
How long till we go this way?
That's a great question. What we saw in South Africa was a relatively quick up and quick down. We're starting to see some evidence out of the UK that they are kind of seeing the same thing. So we think maybe by the end of January, things should be looking a lot better.
And what's that mean?
Well, I think it means that the virus is going to run out of fuel, right? If you think of the virus like a wildfire, a wildfire needs to have new fuel to keep going, right? And I think it's going to run out of people to infect after a while.
And do you expect another variant to come along? Like this Omicron came along and all of a sudden it was 2 people in South Africa. Now it's all over the world.
The way that this virus mutates, there are other variants out there right now we don't know about. The question is the next variant going to be able to bump off Omicron? And we thought Delta might be the worst, but it turns out that Omicron is pushing out all the Delta that we saw last week.
But it's not as dangerous.
But maybe not as dangerous. And so if there is another, and I'm hopeful here, this is the silver lining,
Yeah.
if there is another variant that can push out Omicron, the hope is that it doesn't make you as sick as Omicron.
Do you wish you retired as a firefighter and you're sitting sitting on a beach in Mexico right now, going, "What the hell am I doing this gig for?"
Man with an awning,
And
a hammock.
Gail's throwing you all this shit. I mean, Gail's throwing you. He's throwing you at us.
Yeah,
I mean,
that's
you
right.
get to be interviewed by us. It's the lowest of the low.
Well, if I knew this was in my future, I think I would have retired. But
So hang on.
Yeah.
So Gail sent me a text a week ago. She goes, "Make sure you ask the doctor
I agree.
Okay.
about the poop king."
Oh, that's
Can you
me.
explain that?
And we want to know. I'm like,
else
so I
is there to
texted her back.
say?
I go, "What's the poop king?" She goes, "Just ask the doctor what the poop king is."
Okay. So yeah, early on I caught on. It wasn't my idea. It's something that I was very interested in, but it's called wastewater surveillance. So it's actually picking up virus in the sewage. And I said, well, this is perfect. Remember early on when we didn't have enough tests, and in fact, that's happening right now again, the shortage of tests. And it was very expensive to get tested, and especially people who were working all day that couldn't take time away to get tested. And so, what better way to find out how much virus is in the community than to test the sewage? Everybody poops, right? And so
So
this
you
was.
decided you put your wading boots on?
That's a whole different answer than I
Now
expected. I thought maybe you were
that's
like
being
the
dedicated-
45 minutes
Okay,
in the
let's-
number
let's
in
find
the
out.
loop.
So where I do all my coronavirus reading.
But and that's popular though. Was it? Well, New
Yeah.
York did that, and
Yep.
in Europe they were doing that
Yeah.
too. First, I believe,
Yeah.
it did work.
It does work. We unfortunately don't have the money to do it here in Santa Cruz County, but we're seeing it in the Bay Area and elsewhere. And what's really cool about it, and you asked me about...
Hang on a second.
Wait.
There's nothing cool about wetting some shit.
No, you just pull a man cover up and
No,
stick something
I
in
wanna
there.
know-
That's right. You just put a...
Let's get the ducks in a row. So what happened? So
Yeah.
what did you go do as the poop king? What did you
Well,
have to
I didn't touch the poop, but I worked with the sewage treatment plants.
Right.
We set up sampling sites. We sent it off for lab analysis, and they would give us a count of how much virus they were finding in the sewage, and then we could translate that into probably how many people in that area were affected.
Are you getting paid enough to do that gig? What do you think?
Well,
these
that's
things- Would
amazing,
you want a
though.
pay raise?
You know, one man's treasure. Yeah.
Well, it's amazing that it works. And
Yeah. And
Was
it's,
it-
and it's passive. It doesn't mean it means that people don't have to go and get a test, at least for the surveillance purposes, right?
I know we're not doing it full time here in Santa Cruz based on funding, but
Yeah.
the research and the studies that you did you see a correlation with the spike in our cases
Yeah.
and the spike in the sewage?
Yeah, in fact, we get an early signal. That's the big problem with going and getting your nose swabbed. It's great to find out if you have COVID, but it's a late signal. It's somebody who's been sick for a few days. What the sewage picked up was somebody who didn't even know they were infected yet. And so we could pick up spikes early on, and then we can act on those. So it's an early indicator.
I want to back up to the testing question you said. That it's because I am a victim of this. It's hard to get a test in our county right now.
Yeah.
I actually went on an hour ago because I wanted to talk about this. The soonest I could get was January 12th.
Yeah.
I drove to Bakersfield today and got a booster shot.
Yep. Yep.
And I made my appointment this morning
Mm-hmm.
because I had to go there to pick up something anyways.
Yeah.
But I was, for the last 3 days, because I'm traveling pretty soon and I wanted to get one.
Sure.
Why? I mean, I feel
Yeah.
like we are such a dynamic community. Why is Santa Cruz lagging? And I'm not
Yeah.
busting your balls about it. I'm curious.
Yeah. That's a great question. We're a small town. You know, that's part of it. And the other part of it is the demand for vaccine would just go up and down and up and down. So
Right.
it was very hard to have kind of consistent capacity. So we've learned over the last couple of years we have to be nimble on our feet. We have to direct resources to get it done. We're sending teams out to skilled nursing facilities and to home care facilities to get people boosted because they can't get it done. But ultimately, when you have a huge demand like this, like the home test kits as well, right?
Right.
There's going to be these supply disruptions or capacity disruptions.
Well, Devin Nunes wants nobody to take a test.
Uh-huh.
So in Bakersfield,
Yeah.
plenty of tests. Can we send those tests to Santa Cruz? Is it possible?
Yeah, it would
Because
be nice,
they
yeah.
don't.
Is this a governor?
Nobody there wants it. I
Yeah.
showed up and actually we on 9:00, 9:15, 9:30,
Get your
9:45, 10 o'clock, 10:15. Like every 15
Yeah.
minutes you can get. I went there, not a single soul was there to get it.
When I went 2 months ago to get my booster shot at CBS,
Well, there's a demand
in
here.
Felton,
I-
not a soul.
Yeah.
You
And
could- you
Because
should-
there was no sense of urgency at that time.
none. I mean, I thought, okay, I'm walking in the store, there's nobody. I go to the pharmacy, I'm expecting a line.
Well, congratulations to Santa Cruz County residents to want to get a booster. So that's a good thing.
That's a good thing.
But it seems like the state could be, or I'm not sure who's in charge of distributing those things.
Yeah.
But where the demand is, the supply should go.
Yeah.
Because right now in Bakersfield, nobody wants it,
Yeah.
and everybody here wants it.
Sure.
And I'm a victim of that. So it seems like does that frustrate you?
Yeah, it does frustrate me, especially because those folks in Bakersfield really need it. And why they're not getting it, why they're not interested, it baffles my mind. I'll
Yeah.
never understand it.
I don't get it either.
But the thing is, I think most people don't understand about vaccines is they think about, okay, well, this is just medicine for me. And so it shouldn't matter to anybody else whether I get vaccinated. But the way vaccines work is they only work when the vast majority of people use them. And especially with Omicron, because the vaccines have kind of dropped a little bit in effectiveness, they're still tremendously effective in keeping you alive, no doubt about that. But we do depend on almost everybody using it and having it in
Right.
order to be protected as a community. It's like pulling together.
Can I ask you a question? When I was born,
That's your
right?
heater up.
When I was born in Southampton, England, I was given vaccines for whatever reason, whatever they were.
Yeah.
I have scars from the vaccines
Oh,
I was
yeah, yeah.
given from when I was born.
Sure.
I had no choice. I was a baby. my parents probably didn't know what the hell was going on. Just the fact that this is what is going on nowadays. Why? I mean, why are people freaking out about vaccines when we had them when we were born? We were given them. We were given them when we were smallpox, polio, maybe.
Yeah.
Right. I mean, you would. I mean, maybe you. I don't know. But I have scars in my arm right here from when I was born back in 1950. God, you know.
Damn, you're old.
1970. But right?
Yeah.
I know your answer.
And the answer is I don't know the answer. I'm not a social scientist, but
Of course not.
But you know, most adults have had 28 vaccinations by the time they get to our age.
28.
And there was, you know, maybe a few French people, usually kind of the far left, would be against it. There was this false or fake news related to autism, which has been disproven but still lives out there. So vaccine hesitancy is not new, but it's been amplified now. In fact, it's almost like in order to belong to a group, you have to be against vaccine. And we know of stories of people who espouse anti-vaccination, but then have secretly gotten vaccinated themselves, and they don't want their friends to know.
Secretly vaccinated, TC.
Well, I mean, come on, the GOP is famous for that crap right now.
Yeah.
I can't tell you. It's my right to
Come
not
on.
tell you I got it.
Get those sunglasses on.
I know. But I mean, it must be so frustrating for you because
No,
I
I
am
don't
so
think it is.
frustrated because here's why. There's some hypocrites that and people in very high political places that command. They have the respect of their followers.
Yeah.
So what they tell them, their followers believe.
Yeah.
And secretly, they're getting vaccine,
Yeah.
and they're telling their followers, "Don't do it."
Yeah.
That must drive you crazy.
Absolutely. In fact, you know, I wish that our political leaders, all of them, saw themselves as having a duty to the rest of us. And if they really saw their roles that way, there would be no question they would promote the vaccine. But for whatever reason, they made a calculation in their head that they can't alienate this group. So they're playing both sides, to be honest with you. They're protecting themselves, but they're playing the other side.
There was a current congresswoman from Georgia that just got booted off of Twitter yesterday.
She was booted.
Yeah, she got booted because they gave her 5 times, or like a 5 strike thing.
Yeah.
Hey,
Good for Twitter, right?
I mean, you are a smart human. You have the degrees, you have the experience, you've had the job
He's the poop
experience.
king.
You are the poop
What more
king.
can be said, right?
Why do people believe people who are came out of a gym that did CrossFit
Yeah.
and they trust her? Why wouldn't they trust science?
Yeah.
And I don't get it.
Maybe, yeah, and we saw the same thing with climate change science as well. I think that, and again, I'm not an expert at this, and I've read a lot about it, and I still don't understand it, but I think people see themselves belonging to certain groups. That affinity with a group, like science, like climate change is a hoax, for example, that affinity is stronger. They're not able to absorb.
You're that flat Earth person.
Yeah, there you go. Right.
Or you're like the high school kid who hangs out with the jocks, or the cheerleaders, or the nerds, or the skateboarders. Like, it's that bad. It's regressing that much. Almost.
In many ways, it is. It's kind of, in fact, you look at some of the stuff on YouTube and so forth, and it almost looks like juvenile behavior. The way people argue about NASA's.
Your job is, I mean, would you prefer your job right now to be, your job right now must be exciting. There's a lot of shit going on. Which,
right up my alley.
Right? Right? Or would you rather have calm waters and it would be...
Well, I've been on the front lines my whole life.
Right. Which you enjoy, right?
I guess so. You know, being a firefighter, being an emergency physician is kind of a frontline job. And so, this has been very interesting for me. It's been hard. It's been frustrating. There's, I can't wait for it to be over. But in the meantime, I'm finding it very intellectually satisfying.
What would you like to be your next job to be?
I don't know what can top this.
Do you have what gig would you like? What gig would you like? Politics?
I'm not cut
Sacramento?
out for that.
Huh?
I'm not careful enough about what I say to be in politics.
Right, that's why we have you on the show.
Yeah, exactly.
That's why Gail recommended you.
Yeah. Oh yeah, he'll shoot his mouth off. Let's have him on the show.
Right.
Yeah. I don't know what's next in line, but yeah, I thought when I actually retired from the ER 2 years ago, and I thought, okay, this is going to be the easy life. I'm going to kind of chill, and then of course this.
Okay, so just a quick nutshell. People watching online.
Yeah.
How are we doing, Santa Cruz? How are we doing? Do we need to freak out?
Yeah.
Can we go to yoga tomorrow? Can
Sure.
we go work? Can we?
Good question.
Right?
Yeah, because I go to the yoga studio up the street.
Yeah,
I'm
can
like,
we go to yoga?
Yeah.
Can we?
oh my
Can
God,
we
that
do
girl
our,
just drip spit on me.
Can we live our lives? Naturally without freak out or.
Yeah, I don't think. Yeah, great question. I don't think freaking out's going to help anybody,
Right.
including yourself. No, I just think what I advise is live your life. Be appropriately cautious. Don't welcome the virus. Don't give up. There are ways to avoid catching it without a severe disruption in your life. But right now we're going through a particularly tough time, and if you can delay, certain activities, or you can do them outdoors.
But aren't we all going to get it eventually? Aren't we all going to get it? TC going to get it?
I already had it.
Yeah.
Are we all going to get it eventually? As much as we try and wear a mask,
Yeah.
we try to be diligent about what we do, we're all going to get it. Are we all going to get it?
I think at some point in our lives it's inevitable, just like the common cold. The common cold is coronavirus as well. It's
Right.
a different version of it, but I think we're headed there. But I think the consequence of getting infected will become less and less.
Should we just continue to drink red wine and have a good time?
Sure, but
Be
don't
safe.
do it in a crowded room. So me personally, I try to do things outdoors. I'm
Right.
supposed to go to a medical conference next week in San Diego. I'm going to cancel that this time.
What do you enjoy doing outdoors?
I really enjoy bike riding,
Yeah.
hiking. I do snow skiing.
All great
Yeah.
virus activities, right? I mean,
Well, as far as being outside, I think it makes a huge difference.
Yeah.
It's what you do, kind of associated with that can sometimes be a problem.
Right.
I'm supposed to go with 10 other ER docs to Wyoming next month. And so we're going to all test ahead of time and make sure we're okay.
Yeah.
I know we're all vaccinated, but we'll see how that
Is it
goes.
important to get tested? I mean, I don't feel I have anything right now. It's important for me to go get tested. I see people getting. I see people at Monterey Airport yesterday. 900 people got tested yesterday at Monterey Airport.
Yeah. If you're visiting a family member that's vulnerable, somebody who's elderly or has a medical condition,
Right.
I would think it would make sense to get tested.
Okay.
But otherwise, during the regular course of your lives, if you're able to, have safe interactions with other people, then you probably do.
I feel like there's a shortage of tests also right now in
Yeah.
Santa Cruz.
Yeah, especially the home tests.
Yeah. Is there is that a temporary thing? Or is that going to change?
I think it is temporary. Right now, of course, a lot of the tests, in fact, 80% of the state supply went to the schools
Oh.
because they wanted to test kids after the holidays before they went back to school. And so we're seeing this kind of temporary constrained supply, but I think that'll improve as we go forward.
Do kids have less? I know there's a spike in hospitalization. Do they have less symptoms? It seems currently with this new virus, there's less symptoms, which makes it easier to spread.
Yeah, you
Are
remember?
kids less of that?
Yeah, I think so. Typically, a lot of kids will have a mild illness. In fact, most people of all ages will have a mild illness. But you can't really predict who's going to have a severe kind of illness from it. So that's one of the biggest challenges. But one of the hallmark symptoms that you might remember early on was loss in taste of smell, and we're not really seeing that so much with Omicron. So the virus itself is kind of shifting. Now it's very similar to a cold or even a flu.
The people in the hospital, is there no common theme between them, or is it? I mean,
Yeah.
I know if you have a pre-existing condition or like
Yeah.
but currently with Omicron, right? Omicron, is there no consistent theme of hospitalization?
Well, almost all of them are unvaccinated or people that didn't get their booster, and usually it's older folks. So there have been some fully vaccinated people, even people that have recovered from prior infections that have also gotten vaccinated, but have other severe underlying conditions. They didn't get their booster in time, and we've had some of those people expire, unfortunately.
Omicron was a variant came out of South Africa out of the blue,
Yeah.
right? Do you expect something else to come out of some other country out of the blue?
Yeah. As long as you have so much virus that's replicating out there, it's inevitable that you're going to have new variants.
Right.
But whether those variants are successful or not, whether they can beat out Omicron, it remains to be seen.
Okay.
Our past president called it the China.
Here we go.
Yeah.
You talking politics, TC?
But no, but what I'm saying is, a virus comes from Africa.
Yeah.
Could it have come from anywhere?
It really could. In fact, I think South Africa kind of gets they kind of got the short end of the stick here because they actually have really good genome sequencing in South Africa because of all the HIV work that's been done there over the last 30 years.
Yeah.
And so they actually have a really robust system, and they happen to pick it up.
So they caught it, and they got blamed for it.
Now they got blamed for it. Then we, for a while we closed off travel from there.
Mm-hmm. Yeah.
So they got penalized for actually finding it. Who knows where it came from? It may have originated there. That's why we use the Greek letters now. We don't use the country names like we used to.
Right.
Yeah, the China virus thing was really unfortunate because that was signaling to people that, you saw the whole sort of anti-Asian thing.
There's an enemy.
It just, yeah, exactly. And they had to sort of frame it in these simple terms where, there has to be somebody to blame for this.
Right.
And really, this is just the way nature works.
Yeah.
I put a lot of thought into this about that blaming. I just thought about the $1 trillion we do trading with China, and the dependency America has on Chinese manufacturing and labor. We probably gave it to them.
But you do
That's what I'm thinking. Seriously.
Yeah.
They spent a weekend at Mar-a-Lago or something. Like, well, I don't know. Just can we cut that? Let's cut that. But you know what I'm saying is like we probably but of course we have to blame somebody.
Of course you do.
The next one. I mean, are we going to blame Israel next, or what's going to happen?
I just hope for the next one that we're better prepared. There were so many things that we did not do as well as other countries. You look at New Zealand, you look at Australia, they've had very, very low cases. They had robust testing. They had it wasn't politicized to the extent. I mean, you will see anti-vaxxers in every country, but we were starting off behind from the very beginning. We didn't have enough testing. I remember calls in the middle of the night from the ER saying, "Well, I got this guy with no, loss of taste and smell, and this looks really sick. He's got this bad pneumonia, these ground glass opacities on the CT scan. Can I get a test for him?" Can you imagine that today?
Yeah.
Wow.
They were asking me permission to test the patient for the coronavirus.
Right.
That's because we had so few tests at that time.
Right. My sister lives in New Zealand.
Yeah.
How you guys doing up there? She's out there having a cocktail.
Got a smug.
yeah. She's feeling pretty smug. They kept that thing out of there.
The glass thing you're talking about in the lungs.
Yeah.
I have a employee whose mother works at an emergency room in Santa Clara.
Oh yeah.
And she said that a young guy passed away.
Yeah.
And when they looked at his lungs, she said it looked like broken glass.
Yeah, that's the term that they use on a radiograph or on an X-ray image, especially on a CT scan. It'll look like ground glass, like the broken glass from the side window of a car. It just has that kind of irregular sort of appearance to it. Normally, a lung should look black on an X-ray, but this was like filled with this.
Wow.
So you saw
Yeah.
this firsthand.
Oh yeah, absolutely.
Wow.
TZ, the doc
Yeah.
was out yesterday.
Yeah.
Dr. Ghilarducci.
Yes.
Well, Dr.
Thank you.
Dave, yeah, honestly, thank you for coming on.
Oh, I hope it helps.
I just feel like it's becoming too consistent that we have to talk about this.
Yeah.
And I just hope that there's like a time where we can remember what it used to be like.
Yeah.
As a
Next time
retailer, I get people coming in here every day and they want to fight me over policies that Gail and yourself have imposed.
Sorry about that.
No, it's great because I embrace them.
Yeah.
But I just wish that we could, as a community and as a state and a country, be on the same team to end this and work together.
Yeah.
And so I hope that my frustrations become your reality, and all of us can enjoy a
Fruitful.
a normal coexistence that we had 3 years ago.
Right.
Yeah. And more kindness, right?
Yeah.
Between
Yes.
Way more kindness. 'Cause kindness is out the window.
I feel like everybody from whether it's your retailer, a medical professional, a restaurant person, a politician, that we all have more patience to just be aware
Patient,
that we're
kindness.
all going through this together.
Patience
right?
and kindness.
Yeah.
I want to dedicate the show to Dr. Gail Newell, too, by the way.
Yeah.
I want to dedicate
Yeah.
the show to her.
Thank you.
And she came on my show a bunch of times. We had a good time with her.
And
with her wife, we had
Kelly's
the last show.
amazing.
We're like,
Yeah.
what?
Is not Kelly amazing?
Kelly? Oh.
Kelly, you're like,
man.
Kelly's
What
a
did you?
hoot.
We're like,
She
excuse,
is a
what did you
hoot.
just? What did you just say?
Yeah. We're gonna have Kelly back
But
on
we're
the
going
show.
to dedicate the show to Dr. Gail Newell. Doctor, thank you so much for coming on the show. We appreciate it.
It was
It's
a
been
real
good time.
pleasure, guys.
What, you sure?
Oh, absolutely.
He's been on K-Squid TV,
Oh, yeah, well-
big meeting. Right.
BBC,
The BBC?
yeah,
Holy shit.
CNN.
CNN, boy.
I hope your voice
How
is
does-
of reason.
How does this...
You know what
how-
I mean? Yeah.
Hang, well, why did you find out?
The
how this-
BBC, your
Hang on a
hometown.
second. Hang on a second. The BBC and the
You've heard of
Ultimate-
it, right?
Oh yeah, I've heard of it. How did we do it compared to the BBC? Because BBC part of the big production. It was a big
Oh,
production,
yeah.
right?
I much more enjoyed this than the BBC.
But why would the BBC choose you?
No idea.
I mean, why are they not going to like other parts of the country? You know,
Well, I think they wanted to know what was happening in California.
really? Wow, the BBC showed up.
Yeah.
Holy shit, DC.
Well,
That's
they didn't
royalty.
show up. I was on some app
Oh, you were?
talking to them, electronically.
I'd like to thank you.
Yeah.
You could be retired in a sprinter van in Baja in a hammock right now.
Right.
That's good.
Yeah.
The Rebel.
No,
Maybe
yeah, the rebel. Yeah, I like that
Yeah,
rebel.
right.
But instead, you have thrown yourself in the fire.
Yeah.
Some
That's
people
service-
have not been happy with you in the decisions that your department has made, and I want to congratulate you
Service-
for being a champion of our community.
Service.
Yeah.
That is service to the community.
It is. You did not have to do this.
No,
No.
And somebody has to. So thank you for that.
of course.
And I do wish you the best, and I do wish that we are done with viruses very soon.
Yep.
Neil, we got a big show Friday night.
Friday night, Dub Soldier
Live
live
Soldier is.
from the Santa Cruz Apparel Store.
If you have not seen this, Friday
The
night,
following Friday
Yeah.
night is the Dead Campers,
Dead Campers.
and the following Friday night,
Kaboom!
the Expendables.
Wow, we have some big shows coming up. By the way, if you are out and about Friday night, downtown Capitola, you didn't hear it from me. You can hear some great music,
Reggae.
reggae.
Dub
And
Soldier.
with that being said, Dr. Dave, thank you very much. Cheers to you.
You can catch this show tonight on YouTube, a little later on iHeartRadio, Spotify, anywhere you find a podcast. There will be this show. So check it out, Off the Radio Show. Dr. Dave Dr. Dave Ghilarducci.
Not so good the second time.
Thank you, guys. You guys are great.
Thank you
Not that
very
good.
much. Thank you, everybody. We'll see you next time on the Off Lip Radio Show. Good night.